Hi, everyone. Welcome back to the Cabral Concept. I'm looking forward to our chat today with our special guest, Dr. Ernesto, or Dr. E, the stem cell guy. Welcome to the show.
Thank you for having me, Stephen. I'm really excited to be able to share with you and your audience a little bit of what we've been working on these past couple of years.
Yeah, this is an exciting frontier. It really is. When I talk about what does the future really hold for somewhere between natural medicine and conventional medicine, I see the gut microbiome, I see genetics and being able to personalize your genetics, and then I see stem cell therapy. Those are kind of the big three for me, and there's obviously a lot of different branches from those. But I'll tell you, as an outsider to the stem cell field, I consider myself more of an insider for the gut microbiome and genomics, but not so much for stem cell therapy because it really is out of my realm. But that's why, again, I always look forward to our Thursday shows, but we have not had an expert in stem cell therapy. And that's from hoping you can give all of us a lot more insight here today.
Yeah, absolutely. I'd love to.
Just so everyone knows, you are based right now in the world.
I am in Spain. We've been here for the last 18 months. Before that, we lived in Cancun, where I set up and ran a stem cell research facility and treatment center for several years. Then I lived for about a year and change in California, also related and working in the stem cell field. So yeah, we've been all over. Right now, I'm focusing most of my time on consulting with physicians in terms of physician entrepreneurship, but also in patient education. So, helping them choose the right kind of stem cell treatments, helping them figure out if stem cell treatments are right for them, and being able to refer them when they qualify and when we believe it's a good approach.
Excellent. And the reason I asked that too is, and I'm sure we'll get into this later in the show, that not all of the treatments available worldwide are currently available in the United States. So I know of people going to South America or Panama and in different areas where it is more widely available, for better or for worse. And again, we'll get into that. And so that's why with you working in the US, working in Mexico, and also in Spain, it gives us a lot of insight as to how it's being used throughout the world. So for people that don't know what stem cell therapy is, can you let us know what type of therapy it is and where these stem cells coming from?
Sure. So when we talk, first we need to understand how stem cells work in reality, right? So we all have stem cells. You, I, everyone listening, we've got stem cells. That's how our body heals. That's how we grew up as children. That's how, when we fall down, just a very crude way of explaining it, we fall down, we scrape an elbow or a knee. We need to repair those tissues. And of course, there's some scar tissue, but there's also some regeneration. And it's the stem cells that repair. So basically, and the way I explain this to my patients and to the parents of our patients and to a lot of my medical students is, and the reason why they're called stem cells is because they really a single cell, and from their stem, they specialize the different tissues. So we have one common cell, and from there, they start differentiating or maturing into specific families, and then they start branching out into more specialized cells. So it is kind of like when we're children and everyone goes to the same elementary school, right? We take the same classes. And then as we start moving along, we start understanding what we like and which way we'd like to go. We might start taking some different specialties, different courses. And after a couple of years, children who went to the exact same class in elementary school end up being a physician, and the other one ends up being a tax attorney, which have absolutely nothing to do, but they started at the same point. Same thing with our cells. We have these stem cells that start at the one specific same point, and then they mature. And you can have blood cells, you can have muscle cells, you can have tissue, bone, brain, GI, gut cells, all these different things. They come from the same stem cells. They come from the same origin. And when we say stem cell therapy, it basically means that's the medical process with which we leverage the power of stem cells and we put them in a specific area to achieve a specific result. Because we always have stem cells circulating, and they're the ones that identify when everything that we're breathing from the environment and it hurts our lungs. We need to replace those cells, right? So it's stem cells that go in there and repair it. But when we grab the stem cells, we concentrate them, we put them specifically, let's say in a knee, then that's called stem cell therapy, because we're leveraging the regenerative power of those stem cells and we're putting them specifically where we want them.
Yeah, that's interesting. And that's a really good way to explain it as well. It's even like, you think of a naturopathic doctor or a dermatologist or a psychiatrist. They all do essentially the first 2 years of medical school, right? It's like everybody learns their oncology, their embryology, like everything. And then all of a sudden it's like, okay, well, how does that person, end up over there? Well, that's that specialization. So I really like that. That makes a lot of sense to me. Now, what are people using stem cell therapy for right now? Like, what are the different areas that we can use this? I know you mentioned about joint-based repair. Maybe we can talk a little bit about how that works, but then also what else is it used for?
Sure. So, stem cells will help, like we were saying right now, they can regenerate pretty much any kind of tissue because they essentially become that kind of cell population, right? And then repopulate and repair whatever is there. So technically, in theory, they are really repairing anything. You could technically use them for almost anything that has to do with a damaged tissue. So anything that has to do with inflammation, autoimmune disorders, neurological disorders, neurodegenerative disorders, cardiovascular disease, even gut disorders, joints, muscles, tendons, all of those things, also for pain management, even for skin disorder, for cosmetic issues. And the thing is, it's not that it's a magic bullet. It's just that it is our body's own repair mechanism. So we're just putting it specifically where we want it so that it is harnessed in a way that it does what we want it to do. And you spoke at the top of the podcast about gene therapy or genetic manipulation. And that's essentially the same thing because you're basically changing the code of our cells in order to get them to do certain things. And when we're talking about stem cells, it's a way of grabbing those cells and putting them specifically where you want them. That's why the spectrum of things that you can address with stem cells is so broad.
So let's talk about, let's say someone is having, they've got a meniscus tear and they've got wearing away of the anticular cartilage around the femur. And so they have got a lot of joint-based pain in their knee. And that's very, very common. So would someone be able to, obviously with a medical doctor, inject, would it be differentiated stem cells into the knee? Or would it be undifferentiated?
No, you would be treating with undifferentiated stem cells. There are a lot of studies. There is a lot of research that's been going on in differentiating these cells. Truth of the matter is we're still not that good at differentiating those cells. We know that there are several factors that if you grab a stem cell and you put them in, you grab a colony of stem cells, you put them in a petri dish, there are a lot of factors that will determine which way they start differentiating. But we're not at a point yet where we can say, oh, I'm going to start growing, nerve cells or muscle cells or whatever, right? So you use undifferentiated cells. These are adult stem cells, and we can also, later talk a little bit about the differences between embryonic and adult stem cells. And these are stem cells that you would put directly into the joint, and they would stay right there. You would inject them right there. And the way the stem cells react and recognize what's happening and what's going on is that they recognize inflammation. So when our cells express these different inflammatory markers, the cells in our body, and an inflammatory marker is basically, again, the way I explained this to my non-medical listeners is imagine that your cells hold these little signs that say, you know what, I'm damaged, I'm hurting, right? When you are in a car accident and you have a flat tire, for instance, you get out of the car and you put your little cones around and things like that to signal other drivers and eventually to signal the emergency cars, right? So our cells do the exact same thing. When there's an injury happening, when they're hurt, when there's inflammation, anything that's happening inside the cell, they start expressing these little inflammatory markers. And the stem cells recognize these inflammatory markers. They migrate specifically to that tissue, and they start repairing. They start releasing cytokines. They start calling in for other cells, and they basically trigger the repair process. They control and mitigate the inflammation. They start recruiting. They start calling other cells into the area, and they start repairing and eventually regenerate the damaged tissue. So that's exactly how it will work. The closer you can get the cells to the specifically damaged area, the more effective it's going to be. But a lot of the times you don't even need to go like super specifically, like microscopically to the same place. You can just put them nearby and they will migrate because they do have that ability.
And I do want to get into that in just a few moments because some of the research on that is absolutely remarkable. But what does the success rate look like for being able to use stem cell therapy, and are there limits to it? Meaning, like, at some point, if the joint is severely damaged, how much can it repair? Like, it's not going to rebuild all of that articular cartilage. Is that correct?
That's absolutely right. And you just totally hit it. Because what happens is that it will help. Remember that the stem cells will regenerate. We're not at a point, I mean, again, in vitro, there are some research of, okay, we can grow ears and we can grow cartilage and we can do all these things. But in vivo, which means basically inside the joint, what we're seeing is that they regenerate, right? But if you have a knee that is bone on bone already, there's no cartilage there left to regenerate. So the only thing that the stem cells are going to do at that time is they're going to decrease the inflammation, maybe repair some of these different bones that are already, hitting each other and grinding against each other. So that's something very important to notice, and that is where we need to understand the limitations of stem cell therapy, and that's why I've been through my entire career, and I was a faculty at the Stem Cell Fellowship for the A4M, and I've been working in the field for several years. And one of the things that I always emphasize is just as important as the stem cells themselves is the physician who's administering them. Because you need to understand the limitations. And in order to understand the limitations, you need to understand the pathophysiology of whatever it is that you're treating, the clinical presentation, and all these different variables related to that in order to determine if stem cell therapy is the right tool for that one particular moment. Because that's what stem cell therapy is. It's a tool in a physician's toolbox. The problem is when a physician, or when even worse, someone who's not a physician decides that, I'm just going to buy the tool and now I'm going to start curing everyone of everything. And that's where the problem comes.
Yeah, absolutely. That makes a lot of sense as well. How can people, like, when are the times to advocate for it, even if let's say it's available or not available? So let's say someone has a labrum tear in the shoulder, or they have a meniscus tear in the knee. Those are pretty common, or even in the hip as well. Are those times that they may see benefit from it?
Absolutely. And what we're seeing is that regenerative medicine, and the more time passes, the more studies are being pushed out and are being published to support stem cell therapy, or regenerative therapy in general, not just stem cells, but regenerative therapy in general, as the first line of treatment for most orthopedic and musculoskeletal disorders. Because what happens is that it's the least invasive, it's got the best recovery rate, and if it doesn't work, you're still 100% candidate for everything else. Let's say, we spoke a lot about this with patients, and if you get a hip replacement, if you get a knee replacement and it doesn't work and you're still in pain, you're no longer a candidate for stem cells because there's nothing to regrow there. What are you going to grow, a titanium, cartilage? It's just not going to happen. So it should be the first approach. Unfortunately, it's still not covered by insurance, and it's still not very affordable, frankly. But, yes, for most people, it should be the first thing they consider.
Now, are you familiar with PRP therapy as well?
Yes, of course.
So a lot of people, they have the option to be able to do PRP, but they're confused that, I think, oftentimes with stem cell therapy. Yes. With PRP, you're getting the platelet-rich plasma, but I don't believe any stem cells come along with that. Is that correct?
That is correct. You do have stem cells circulating in your blood, right? So let's assume that you do a blood draw for the PRP, and there are a few stem cells, which are going to be very, very, very small numbers, but let's assume that there's a few of them there. Once you spin it and you separate based on densities, because that's what the spinner does, you're going to grab the platelet-rich plasma. There's no cells in there. So no stem cells are going to come in there. However, what we do is that we combine the patient's own platelet-rich plasma with their own stem cells, even when they're allogenic, when they're like cord blood donor stem cells or anything like that. You combine those before you inject the patient. And the reason you do that is, if you recall, a couple of, one or two questions ago, and I explained how stem cells recognize where they need to go. and it is by these inflammatory markers that the cells express. There are other things that the cells also express. They have their little signs, their inflammatory markers, but they also release cytokines, which is the equivalent of calling 911 or sending a text or sending a tweet, letting people know that you need help, right? And these go out, these are little molecules that go out into the bloodstream, and they start calling these emergency repair cells, right? The platelet-rich plasma has those cytokines from the cell. So if you grab the patient's own platelet-rich plasma and you combine it with the stem cells before you infuse it, you, in a way, activate these stem cells so they're already kind of like primed and know what to look for. That's why it's very commonly combined. Having said that, that's why I also said the first line of treatment should be regenerative medicine, not necessarily stem cells. PRP is a completely valid method of regenerative medicine component. It's a component of regenerative medicine. So you can absolutely try PRP first. If you go in as a patient and you have, that exact same patients that you said, you have a labrum tear, and you go in and maybe you cannot afford stem cell therapy at that time, your physician is not offering it or whatever the reason, PRP is a great first alternative. And you can do 1, 2, 3, 4. It's the same thing. You're still a candidate for everything else afterwards if that's not giving you the relief you're seeking.
100%. And that is absolutely what I recommend as well, because there's almost no downside, only upside. And there's also no guarantees with surgery. I know many, many people who have had knee replacements, hip replacements, shoulder-based surgery for the rotator cuff, and they may have fixed one issue, but then another issue arose because of how it was set. Meaning whenever we set things differently, like you said, with a titanium rod in the hip, it's no longer yours. And if it's just a 2 centimeters off, then you're going to have then some gait-based issues with walking, and the same with your shoulder as well. So if people are able to look at a couple of these things first, but I agree with you, unfortunately not covered by insurance right now, they could save themselves a lifetime of pain. The only question I have for you is that with PRP, you're probably looking at 4 to 6 sessions, and that is going to be like every week to every 2 weeks, I believe. I love the idea of being able to do both at the same time. I mean, that's really smart to be able to do that if you can. What is it? How many sessions do you need with stem cell?
It depends entirely on what you're treating, the kind of stem cells that you're using, the kind of therapeutic approach that you're utilizing. And in order to address those, if you want, we can go into the differences as to the legalities of it and what's available in the U.S., because that's a real limitation to delivering the best kind of stem cell treatments. And that's why patients in the U.S. who do their research and who need stem cell treatment, they go outside of the U.S. because you simply cannot get the best kind of treatment currently in the U.S. because of the laws and the regulations, which is a shame, but it is the reality. There are several of these different limitations. One of them, specifically by the FDA, that they don't allow the use of stem cell therapy in different modalities.
Yeah, and I'd like to talk about that in just a moment. I would like to go over, though, right now, other uses beyond, let's say, joint-based repair, because there are many people and some research going on right now. One of my favorite, it's on mice, but they take older mice and they infuse the blood from younger mice, or they actually connect the two mice, and the older mouse actually begins to take on the properties of a much younger mouse. And obviously, I'm taking this really down to the basics right now, but they are now in the process of doing these same studies. There was a $10 million grant actually given. I believe Peter Thiel is part of it as well. I'm not positive, but I believe that he is. And using the blood from essentially college students and infusing it in much older adults, and with the undifferentiated cells, not anywhere in particular, and looking at the different anti-aging-based properties of hair, skin, nails, organs, etc. Could you talk on that a little bit? Because I know that anti-aging is such a big part of this field.
Well, there are a lot of different components in what you're talking about. Obviously, once you grab the entire blood as a tissue, has different cell populations and has a lot of different components besides both cellular and non-cellular. So as we said earlier, we've got cytokines, we've got growth factors, we've got the platelets, we've got the different the white blood cells, the red blood cells, and a lot of other things that are usually in the blood. But what we're seeing is that because we used to do a lot of treatments with stem cells, is that these stem cells do have that regenerative potential. And what happens is that, remember that once the stem cells go in, they can differentiate and become these particular, this different tissues. But their most important function is that they will trigger autologous stem cell production. So our stem cells are produced in the bone marrow. We have some circulating when we need more. There are different signals that are sent through our body, and our bone marrow pumps out some more stem cells. There's been a lot of studies done that they have shown unequivocally that patients in their 60s and their 70s, they have a smaller amount of stem cells in their bone marrow, but they still have large numbers of stem cells. The problem is that they're now not as receptive as at these different stimuli to push them out. So if you do a bone marrow aspirate, which is a great way of obtaining stem cells, and you culture those cells, you're going to have great numbers of it. But going back to what you were asking, when we infuse younger stem cells into an older person, and these stem cells start releasing all these different growth factors and cytokines and start recruiting different cell populations, they start promoting the release of newer stem cells from that same person, despite the fact that they were normally not pumping out as many stem cells. Now they start being stimulated to promote and to pump out these, to produce and pump out these new stem cells and trigger repair throughout the body.
Now, is that because essentially they turn back on the feedback loop? So, exactly. When we get stressed, we're going to then start that HPA axis. So this essentially, as we age, we start to slow or shut down or become a little bit quiet to these feedback loops. Although whether it be the adrenals or the thyroid and your bone marrow can produce these if correctly given the right stimulus.
Absolutely. That's exactly what we've been seeing. At first, we used to believe that, as you age, the number of stem cells that you produce decreases because the initial bone marrow biopsies proved that. They saw, you have X amount when you're young, and as you get older, you have less amount. But what we've been seeing is that 70-year-old's bone marrow still has huge numbers of stem cells that are viable. The thing is, they're just not being pushed out into the bloodstream because of, very well might be that we start responding less and less to these different feedback loops.
It's interesting. It's our bodies really can be this self-repairing entity, an organism. It's just there seems to be a code inside of us that begins to atrophy and create entropy as we age. But there may be a way for us to slow that dramatically, or in the distant future potentially turn that part off.
There is, and you're going to like this because it is something that you've been talking about for a while, and most people in the community and most of our listeners are familiar with, and it is just leading a healthier lifestyle, making sure that you're exercising, making sure that you're getting, sunlight, that you're getting physical activity, that you're breathing well, intermittent fasting, different fasting protocols, calorie restriction, low carb dieting, all of those things prevent us from developing that wear and tear in our different tissues. And that prevents our stem cells and our feedback loops from not responding. Because remember, and this is something that I always said, irregardless of what kind of treatment we are providing with stem cells, stem cell therapy is not something you do instead of. It's something you need to do in conjunction with a healthy lifestyle. It's never the answer to an unhealthy lifestyle.
Yeah, absolutely. Because you're only compounding inflammation, right? So you just have to do stem cell therapy then your entire life, I guess, if that was the case, and still wouldn't be helpful.
Even then, you're never going to catch up.
Right. That's a good point to make for sure. This is an add-on, an adjunct, not a replacement for anything, and that makes sense because all the things you just named help with telomere. It helps with overall inflammation, and of course, stem cell can be part of that. So let's now talk about some of the legalities. What can we actually do? I know that this is a global-based health community that we're talking to, people literally all over the world, Europe, Australia, you name it. So now, again, when we're looking at it, many people in the United States, they want to be able to take advantage of this. Better off in Europe, South America, Latin America. Where are we able to take advantage of this? And in the United States, can we do any of it at all?
Yes. So there are some stem cell treatments that are available in the United States. So before we actually dive into this, if you don't mind, let's just talk a couple of definitions. We have we can divide stem cells into based on what level of maturity they're at. So when we're talking about embryonic stem cells are a big no-no pretty much all over the world, except in some places in India that are using them. They're the most powerful ones, but we still don't know so many things about them. An embryonic stem cell can give rise to an entire new being, while adult stem cells, they can't. They cannot, on their own, create a new person. Embryonic can, adult stem cells can't. They're still immature in a way. People think that, when you do, you get the cord blood from a newborn and you're getting stem cells, they have a hard time understanding that it is adult stem cells because they come from literally a newborn, but they are adult in terms of maturity, right? So the adult stem cells are the ones that you would be using in different scenarios. The embryonic, like I said, they do have a lot of potential, a lot of power. As far as I know, they're only being currently utilized in some places in India. I believe some places in the U.S., not in the U.S., in Russia. But I probably would not recommend them at this point for any therapeutic applications unless it was like a end stage disease and you were like really willing to try them. Now, when we talk about adult, we can divide also stem cells in the source that they come from. If they're from the same patient, they're called autologous. If they're from a donor, they're called allogeneic, right? So most cord blood-based treatments are allogeneic because they're from a cord blood donor, unless you stored your baby's stem cells and you stored them in a cord blood bank, and then several years later you use them for that one same baby. In that one case, that treatment is autologous, but for everybody else would be allogeneic. In the US, the only FDA approval for the use of stem cell treatment is autologous. So when it is obtained from the same patient, and the sources are usually bone marrow or fat, most commonly is from bone marrow aspirate, and they cannot be manipulated in any way. So you cannot digest any of the fibers if you're doing fat. You cannot modify them. You cannot mix them with PRP. You cannot do any of those things, right? And here's the kicker. The treatment has to not be systemic. And the definition of the FDA for systemic is if a treatment affects 2 or more organs. So it doesn't mean that it has to go in the bloodstream. It means that if it is touching or affecting 2 organs or more, it's considered systemic. That's why you cannot even do lumbar puncture with stem cells like we used to do in Cancun, because it affects the brain, the brainstem, and the cerebellum and the cerebrospinal, even though it doesn't go through the entire body. So I know this was a little bit confusing, but it's important to understand so that we can know what's allowed. And that's why the most common type of treatment in the US are orthopedic conditions, because you go specifically into the muscle, you go specifically into the joint, you go specifically into the one area. That's why those are commonly offered by orthopedic surgeons, by some chiropractors, which they shouldn't be doing, by some naturopathic physicians, and some pain management doctors, because those are the ones that are allowed. Now there's the off-labels as well.
So just a couple of questions there, because obviously we went through a lot there. Embryonic stem cells. So I think probably some ethical and moral issues come around how those embryonic cells are being gotten. Is that correct? That's one of the big issues I'm assuming would be there. Is there an ethical way to be able to get embryonic cells?
That's a good question, and one that give rise to a lot of misconceptions. So it's important to understand the difference. People think that embryonic stem cells are obtained from an aborted fetus, and that's not the case. Embryonic stem cells are obtained by, when you go to an IVF clinic, they fertilize a lot of eggs and they try to implant them. And a lot of times couples don't need all the eggs that have been fertilized. So those are the cells that they utilize, which if they weren't being harvested and used for stem cell treatments, they would be just thrown away and discarded, right? So There is still the ethical conundrum. Personally, I don't exactly still know which way I would lean on. And I haven't given it much thought, if I'm being honest with you, because I know that there is currently no real therapeutic application that would be going out to the public. I'm sure that when the time comes, I will personally invest more time into really figuring out where my own ethical boundaries lie, because these are cells that are going to be discarded one way or another. So they, they might as well. Some people believe that they might as well just be therapeutic for other human beings. Some of them think that no, they just throw them away. So there's the ethical conundrum right there.
Yeah, no, it is. That is a challenging one, and there's arguments on for sure both sides. Could those cells potentially help another life if they're not going to be used, or is that a life? And that's a difficult one. But again, we don't have to even, I guess, go through that right now, since you said really it's only in India or so that's using those right now, at least that we know about. I'm sure. I always believe that there's a lot going on that we don't know about, and maybe even our own country, but who knows? So another question that I had there is, for me, this was now I have 2 daughters, 6 and 8 years old, and even for our first daughter, we thought about saving and being able to utilize placenta and some stem cells, et cetera. But we were not confident as to how they were going to be stored and who would have access. And it was because of that, we decided we had to weigh those pros and cons. They're very, very difficult decisions. So we decided at that point not to, and then because you can always play, I guess, Monday morning quarterback and go back like, I wish we did, I wish we didn't, but you never know. So right now, your really best bet is to be able to say, okay, I'm assuming bone marrow is a better place to get stem cells from rather than fats because of the quality and quantity. Would that be correct?
Not necessarily quantity. If you go per cc, there are more stem cells in fat than bone marrow. However, in order to harvest stem cells from fat, you need to do a microliposuction. Have you ever seen a microliposuction? There's scraping, there's pushing, there's tearing, there's injuring tissues, a bunch of cells break. What happens when a cell breaks? They literally spill their contents. And for those who are listening to us right now who aren't in the medical and clinical fields, what happens when a cell spills its content is it triggers inflammation. That's kind of like the most surefire way to trigger inflammation fast when cells break, right? So once you have that tissue out, you're going to have a lot of inflammation going on. A lot of cells are already being recruited. And then you have to separate everything that's happening and try to rescue as many cells as you can. So that's a tougher process. It got a lot of popularity, especially in the US, because when the FDA's regulations were still more, they had more gray areas, a lot of plastic surgeons, they figured out, well, I'm already doing a lot of liposuction and I'm pulling out, gallons of fat from some of these patients, might as well just harvest some stem cells there and then use them. Now the FDA has very unequivocally said that that's not a therapeutic application, and I know that a lot of people are still using it. The FDA has been very clear about it, that you shouldn't be using it for treatments. Now, outside of the US, could you use it? Yes, you can. The best way, and countless studies have proven it, is still the most viable are still bone marrow cells.
Got it. That makes sense. And one more question around this as well is, let's say that you are able to get stem cells from someone else other than yourself. So do we have to worry about, almost like an organ donor, any type of autoimmune based reaction to someone else's stem cells, although they are undifferentiated?
There are things you need to worry about, but that's not one of them. Because all of these cells, when we get them from cord blood, which is the most common source of these stem cells, you commonly get them from either cord blood or the cord tissue itself. They call it Wharton's jelly, and Wharton's jelly isn't really a jelly. It's more like a solid tissue, and they have to mince it before they grab it. But anyway, what's happening is that these cells are going through the placenta, right? They're going back and forth between the mom and the baby through the placenta. And what the placenta does, amongst many other things, is it strips off the different surface markers that the antigens that will recognize it as one person's, because they're literally exchanging blood between mom and the exchange a lot of cells between mom and the baby, right? So the likelihood of you getting a a rejection response from these cells is nearly inexistent. However, the one thing that you do need to understand and you do need to recognize is when you're talking, and I guess you're talking about the different cord blood products that are currently being offered in the US, these off-the-shelf stem cell products from different manufacturers, and that a lot of doctors have in their freezers now. And they say, oh, just come in and we'll thaw some stem cells and give them to you. These products have remember that I told you that the FDA does not allow manipulation. They don't allow you to culture these cells. They don't allow you to do anything other than, okay, I pulled it out and I flash froze them and now they're ready to go. What happens is that they are claiming 20, 30% viability. Those are great numbers. They tell, you're buying 30 million cells and they got 30% viability, so you're going to get 9 million viable cells. That's great. That all sounds great. What's the other 70% though? What's going to happen with all those other, 21 million cells that are not viable? Some of them are broken. Some of them are simply not viable. So remember that we said when a cell breaks and it spills its content, triggers inflammation. What is that going to do to a person who is otherwise healthy? Not much, right? And this is what we're seeing. A lot of doctors, they get these cells, they test them on themselves because that's what they do. They're like, oh, they sent me a sample, so I'm gonna try it myself. And they give themselves an IV and nothing happens. They actually feel pretty good because it decreases inflammation and all sorts of things. And then they decide, oh, it's safe. I'm going to start treating my patients, or some people with multiple sclerosis or with other autoimmune disorders. What's going to happen when you give a person with an already overactive immune system 70% non-viable cells? You're probably going to start seeing some immune responses. You're probably going to start seeing, the things that we started seeing were really shocking. You saw, mast cell activation in children that they brought in because they wanted to treat autism. They suddenly decided they were autism experts, or they wanted to start treating patients with multiple sclerosis, or they decided that they wanted to start treating patients with all sorts of neurologic, Parkinson's, Alzheimer's, all sorts of things. And going back to what we said at the beginning, my personal belief is that as a physician, if you do not treat a particular condition without stem cells, so if it's not in your wheelhouse, assuming that stem cells were not a tool, and that particular diagnosis is not in your wheelhouse, you don't have the right to treat it once you get access to stem cells simply because you have access to stem cells.
I think that's a good rule, meaning if you don't have the knowledge base to treat it in other ways, then using stem cells could be more dangerous than it's worth. And it makes a lot of sense, meaning if you're giving someone, if you're putting anything in someone's body, it's going to be detected and it's going to have to either be, it's going to have to be removed one way or another, because eventually everything has a lifespan. And so that means then your liver, your kidneys, some detox organ is going to have to clean that up. And with so many people already compromised because of whether it be too much adipose tissue, too much body fat, too much processed food, alcohol, drugs, you name it, obviously then that's going to be a lot more total body burden on the individual. So that's a really good point to look at. And with the mast cell activation, we have many people with mast cell activation syndrome in this community. And for them, I could see, because essentially what you're saying is these stem cells aren't necessarily doing the repair themselves. They're signaling repair needs to take place. And cytokines and histamines are all part of that process. And now you're aggravating to a greater level. So for them, I would say under the skilled care of someone who knows what they're doing, they might do a much smaller dosage. You get used to that. You do a little bit bigger dosage, then a little bit bigger. Would you say that might be the way to go?
Yes, absolutely. You can pre-medicate depending on the patient, and you can use different factors. Now, the great thing about stem cells is, again, remember that the stem cells are smart. They recognize the environment. They will release the appropriate cytokines and in order to recruit the right kind of cells. That's why we can use stem cells in autoimmune disorders when we have a hyperactive and high inflammation. But we can also use it in patients who are immunocompromised, and they will boost up the production of certain immune factors, right? Because they will recognize these and do that. But what you just said is key to it. If you imagine a patient who already has a hyperactive immune system, an immune system that's already kind of like an edge, right? And then you throw in all this, 100 million stem cells, out of which 70 million are non-viable. How do you expect them to react?
Right.
Now for those of us who've been doing stem cells, we hear these stories and we're thinking like, what were you thinking? But unfortunately, most doctors don't, and I don't want to say most, I don't want to throw everyone under the bus, but most of these people doing these treatments aren't really thinking things through because they don't fully understand the cell biology. They went to a weekend course that was sponsored by the manufacturer / distributor of these stem cell products, in which 80% of the time they spent in telling them how great their product is compared to their competitors, and they didn't really get any clinical training or expertise. And then on the other hand, they decide that because they have stem cells now, they can treat everything.
Yeah, no, it's a great point. I mean, even after, so I remember graduated, got my doctorate degree, everything was good, and I'm like, oh well, I still have a lot more to learn. And you would go to conferences. And so now I have the ability to start doing, like, let's just say parasite testing. But just because I now have the ability to run a lab with someone to look for parasites or H. pylori or anything else, and I don't prescribe pharmaceuticals because that's not in my wheelhouse, that doesn't mean I should be doing it. Because if I figure it out and I have it and I can't help someone with it, and I'm like, oh, just take some cloves, or like that's not going to help anybody. So, and that doesn't mean, again, that just means, and the reason why I'm saying that is that medical doctors, which Dr. Ernesto is a medical doctor, that doesn't mean you're trained in medical school on stem cell therapy or how to use this inside of a practice. This is all postdoctoral based work that you should, have studied. And so anybody having this done, you want to make sure that the person that you or clinic that you're working with, obviously that they are experts in this.
Yeah, and the stem cell, I always said stem cells are a tool. And how you use them depends on the hands of the person you put them on. Mm-hmm. And when people say, okay, so for instance, if you ask me, what kind of stem cell treatments have I performed? I'll tell you none. Because I'm on the preclinical side of this whole thing. I've always been, working on developing the different therapeutic approaches and then putting together a team of specialists that do these things. So we've treated ophthalmological disorders with an ophthalmologist. That's the one that injects people's eyes. I don't do that. Mm-hmm. We've treated orthopedic disorders with an orthopedist. We've treated neurological disorders with a neurologist and hematologist, and we've treated different processes with the cardiologist, with the urologist, depending on what we're treating, because that's exactly what you need.
Yeah, 100%, without a doubt, especially when you're looking at this. So we talked about more of the hyperactive immune-based response and the different issues that could be created here. But what about, a lot of people have the thoughts of, and I don't necessarily, don't know if I agree with this, because you are not injecting in any type of IGF-1 or growth hormone, but is there the potential that these stem cells could cause cancerous tumors to grow?
Not really, especially not when they're autologous. I mean, again, the likelihood is really, really, really small. It is something that has to be considered, and that's why if you're using certain kinds of cells, and depending on the kind of treatment that you want to use. For instance, we had at our main clinic, we had a contraindication that it was anybody who had cancer, obviously active cancer, or had cancer in the last 5 years and was not considered in remission or cured, we wouldn't provide treatment for at that time. But the likelihood is very, very small, especially if you don't have risk factors, if you haven't had it yourself. If you have had it, then you might want to consider it. And that's when I always tell my story. I've had 3 stem cell treatments myself, 2 of them autologous, 1 allogeneic from my son's cord blood, and I'm also a cancer survivor, and I seem to be doing fine. So,
yes.
And I didn't consider that as a risk either. So I weighed the pros, the cons, and it's stem cell therapy is remarkably safe when it's in trained hands.
That's right. Yes. And with that caveat there. So right now, it looks like in the United States, it's really in the hands of orthopedic doctors. Yeah. Just any other uses for potential anti-aging overall besides that?
Legally, no.
Okay. Yeah.
So legally, remember that the big caveat here is non-systemic, and that's the most important thing, considering the FDA's definition of non-systemic and obviously non-manipulated and all these different things. So when you talk about autologous, most of the time you're talking pain management doctors and orthopedic surgeons. However, dermatologists could, and there are some dermatological applications specifically for cosmetic purposes, right? So when you're doing kind of like microneedling and kind of like the same thing you would do for a vampire lift, you can do with stem cells and with PRP. You can do kind of like mesotherapy around the scalp, and that does promote the regeneration and regrowth of hair. It's a pricey procedure for that, but it could work. You could use it for penile enhancement and for vaginal enhancement, the famous, which I don't know if I can say here what their trade names are because they're trademarked, the P and the O. But you could use them for that within the FDA's legalities. Now, the other thing that is important to notice is that the manufacturers of over-the-counter stem cell products will say that they have FDA approval. They don't. Their products have FDA, or their labs have an FDA registration, which means that they basically told the FDA, hey, I have a lab and I'm distributing this product right here, but that's it. They don't have an FDA approval to use it for anything. Then the doctors decide, based on their clinical experience and their expertise, if they want to use it off-label. And technically, it's not even off-label because there's no label yet.
Now, one thing I think I'm a little bit confused on is that, let's say you get an injection in the arm, so it's intramuscular. Let's not say the joint. How does that not become systemic?
We don't know.
Okay. So we just don't know where those stem cells travel to, and it's certainly not. So when you get an IV, we're putting that in the vein. So that's a little bit different. But with the muscle, we just don't know how far they travel. Is that correct? Okay.
Exactly, because the stem cells will migrate. Most of them will stay where we put them, but the stem cells will migrate. I mean, if you put them directly into a capsule, let's say inside a joint, a closed joint, then sure, they're going to largely stay there. Other than that, it's really difficult. You're playing a game. I mean, even the FDA is not super clear in their definitions. They're just trying to, between you and I, just because I'm in Europe right now, they're just trying to make sure that pharma still has their business and insurance still have their business. Because I honestly don't see a clinical reason as to why they are so adamant about halting the progress and the development of regenerative medicine. Yeah. There's simply no clinical reason.
And I think you're right. I mean, I think that if this does work, and I believe it already has been proven to, at least to a degree, then that could severely cut down on the amount of medications and different items that people do need. So it makes sense to me. So let's say that people want to use this beyond the orthopedic or cosmetic-based reasons. Are there clinics that you've ever been that you feel comfortable recommending that people may look into? Obviously, this is their choice. We're not making any recommendations. We're not providing any medical advice. But are there specific places that you do recommend that are doing a great job? For example, just to let you know, like we might say, hey, people can look into the Gerson Plus-based clinics in Mexico. They do treatments there that aren't necessarily allowed in the United States. And maybe you're doing that in conjunction with, an integrative medical doctor here in the United States. So, something like that.
Yeah, there are several alternatives, and I always like to. That's exactly what I'm currently doing right now. If somebody approaches me and says, like, "Listen, I have this. What should I do?" There are a few. Obviously, the clinic that I helped set up several years ago, and that I ran for many years, we set up a lot of the processes. In Cancun, ReHealth and World Stem Cells Clinic. Those are very specific treatment centers. So World Stem Cells Clinic only treats children with autism and cerebral palsy, and ReHealth does provide autoimmune disorders and does treat for autoimmune disorders and does treat for neurologic, neurodegenerative, and mostly for anti-aging. We have a very comprehensive protocol for anti-aging. Well, we developed, I don't know if they're currently still following that particular one. But there's other alternatives. There are other clinics in Mexico. There's one in Cabo. There is one in Monterrey up north near the border. Then there's Panama. You've got clinics in Dominican Republic. So there are alternatives. If you're halfway across the world, if you're in Australia, there are options in India. There are options around here in Europe, in Cyprus, where some of these treatments are being performed. And what I always recommend people do is reach out to the clinic, reach out to the center that where you're thinking or where you're considering, and just talk to the doctors. Most of the time, you're going to find that I understand why most patients in the US are kind of like hesitant to doing that because they think that they're never going to talk to a doctor. But outside of the US, that reality does not exist. You get to talk to doctors everywhere else. And the reason is because doctors everywhere else don't have to spend 90% of their time charting and fighting with an EHR. It's not that the doctors in the US are stuck up or are a pain in the where. It's just that they are too busy with paperwork and with red tape. So if you're thinking of going outside of the US, contact the clinics that you're considering. A lot of the times they'll have you fill out a brief intake form before they agree to get on a call with you. And most of them are doing video calls right now where you're able to, once you submit some information and they have some background info on you, that way they don't walk into a call not knowing you at all, but they're able to share with you, listen, these are our expectations. This is what we're hoping to achieve. This would be a success in our book. This would be the worst case scenario. This is how much it would cost. This is what your trip would entail. All of these things are addressed in those calls before you have to even make a decision. The one red flag here is if they ask you for a deposit before you get to talk to somebody about your condition, run away. There's no reason for that anywhere in the world. Oh, sure, just leave a $2,000 deposit and we'll schedule a call with the doctor. That's not how it works.
That's good advice. And then how long would someone have to spend, let's say, in one of the clinics in Mexico or Panama or something like that? How many treatments over how many weeks or days?
Well, different clinics have different protocols and different ways of getting to where they want to get. And depending on the condition, you might be anywhere from 3 days to up to a month, some places, depending again on the condition that you're seeking treatment for and the kind of protocol that they're following. Standard is usually 1 to 2 weeks, and you go in and you get the whole treatment. What we created when I was reheld, we created a comprehensive year-long package where people would travel down to Cancun 4 times. And the first time they would get a bone marrow aspirate, we would get the cells, and we would harvest and incubate them in our incubators there because we have those. So we would grow their own cells. And that first treatment was 1 week, and then recurring treatments, the ones afterwards, they just had to go down for 3 days. They would let us know about a week in advance so that we could grow enough cells for a therapeutic dosage. They'd come down, they get the treatment. And that's exclusive for anti-aging, so people who don't have other conditions, and they're easy to kind of like plan. But again, every clinic is different. Every clinic has their own protocols. Remember that this is not an exact science. We're still learning. We're still, working to improve. We're still moving forward. So, we're still changing.
Yeah, absolutely. And that's why in terms of anti-aging, I think it holds so much potential, but there's so much more to come. And the same goes for gene therapy right now. And the same goes for manipulating the microbiome and the strains of bacteria there. We don't exactly know what happens when you start to introduce certain strains of bacteria for each individual, since we have we're all humans, right? We all have a microbiome, but it's slightly different from person to person. And what happens when you add someone else's bacteria? So I think these are all things that we should continue to watch for, but at the same time, many people can start benefiting right now, and the regenerative or the orthopedic based, I can absolutely, I can't personally vouch for, but the amount of people that I know that have done it and gotten great results and then were able to mitigate or get around surgery is worth it. I mean, it really is. So that's the first place I would look for. But I look forward 10 years from now, 15, 20 years from now, and what they'll be doing with anti-aging based medicine and stem cells. So I'm happy to hear that we have people like you giving that research and giving that great advice to other physicians that are able to implement this. So this has been a really fun conversation.
Yeah, for sure. Thank you so much again for having me. I always love being able to share what we've been doing. That's what I tell people. Like, listen, I'm so passionate about this, and I'll just talk to anyone who's willing to listen because it's super cool. I just love it.
That's great. So how can we learn? I mean, you have obviously so much more knowledge and can share so much on this particular topic and others. So where can people find you? I know that you have a podcast. Do you have other writings, a website that people can go to? Yeah, for sure. So DrErnestoMD.com, and you can find everything there. You'll see the podcast there. You'll see what I'm currently doing. You'll be able to book a consultation. You'll be able to, like I said, I'm currently not necessarily not doing any of the treatments myself. I'm not affiliated with any clinic, but I'll be happy to talk to anyone. Like I said, I'll be happy to talk to anyone who wants to learn a little bit more about this, and provide a referral where applicable. And I'll be happy to do the same thing for your audience. So just head on over to DrErnestoMD.com, and you're going to see the links and the right button to click. I will link up all of those here today. And then are you also on social media as well?
Yes, same handle, Dr. Ernesto MD on Instagram, LinkedIn, Facebook. What else is out there? I think those are the ones
those are pretty much it. Yeah. That's great. Anything else you'd like to share with our audience here today?
No, thank you so much for the opportunity. I really enjoyed myself. And if anyone wants to learn a little bit more, just reach out. Or if they have questions, they can send them your way. And I'll be happy to record a follow-up or the answer to those. And then you can publish or share them wherever you see fit.
Well, that's fantastic. Once again, thank you so much for coming on the show and sharing your wisdom with all of us.